this case, we are on the second wave, not only the continent, but also in the rest of the world. And what we have seen is that most of the countries, the second wave has come to be much heavier, more fiercer, and cost more lives and cost more hospitalization on the communities than the first one. It is also likely that we might face a third wave, and therefore, because there is no way of being able to prevent it, we may actually be facing that a third wave, which with its impact will be even probably more devastating. So we, as part of the response, this is one time we have a particular condition that has actually affected all countries in the same way, although it is clear that countries with better resources have a better chance of being able to respond than most of us who are in the continent, who have got relatively less kind of resources to respond. We have the focus at this point, at the beginning of the pandemic, the main focus had to be around, how do we deal with issues of protection of our health workers, the provision of PPEs, as well as the issues of case management, provision of oxygen, ventilators, and so on. The African Union created a task team at that point, which task team had to focus on how we can help each of the countries to work together to find, through pool procurement, have access to markets, global markets, which almost for all intents and purposes had closed down because most of the countries actually started having a whole measure of resource nationalism, where there's most of the requirements were no longer able to leave some of the countries. For example, you couldn't get diagnostic kits and some of the therapeutic agents and so on. So to create economies of scale, President Ramaphosa, as chair of African Union, then constituted this task team, which was chaired by ourselves together with the Commissioner for Social Services at the AU. Now, that actually assisted quite a lot, although there was quite a lot of contribution from philanthropic bodies to actually help to distribute. One of the things that was very helpful at that point was that a formula was created to distribute equitably across all the members of the continent on the basis of the population and need. And so that actually became very, very helpful. At a global level, we've seen the emergence of such entities as what is called the ACT Accelerator, which is a coordinating body that basically pulls together various resources and is looking at various aspects, such as the provision of diagnostics, provision of therapeutics, as well as vaccines, as well as building of the health system. This particular area being co-chaired by South Africa and Norway has actually worked together with various countries to motivate for the world to look at the fact that every country has to contribute equitably in the finding of the solutions and the provision of resources, even to assist those countries that have got less of such resources. And the other initiative that has come from that angle is what is now called the COVAX, which is also a major focus of that, was to cover when the whole world realized that there was going to be the need for vaccines. Everyone went all out to put their resources to bat for the best vaccine possible. So most of the well-resourced countries and high-income countries actually invested in the development of the vaccine, leaving a lot of the middle and low-income countries without any kind of result. So this COVAX came up at that kind of level. At this moment, has got almost 190 communities that are in there. But what is remarkable about it is that in this continent, we've only got about 7 countries that are self-financing. The rest of the countries have to be supported through philanthropic support. And therefore, in the provision of the vaccines here, we have to rely quite a lot on this body, which is called COVAX. At this point, this body is being formed through WHO, CEPI, Gavi, and it's actually on the lines of the wide immunization initiatives, wherein it assists the countries on the basis of the fact that they've not been able to finance their own. So they have, as COVAX, raised about $1 billion, just about $1 billion vaccines, which should then be 1/3 of that, I think 30% or 32% should then be available to the rest of the continent. This is where the challenge then arises, because that 20% initially, but 27% at this point, is not adequate to create what we call the herd immunity. It is clear that for us to get a population immunity, we need a vaccination of about 780 million people. All have to be vaccinated. Otherwise, that means that we will end up being the continent that is seen as the source of COVID, when in fact we're the recipient of the spillover that came from different parts of the world. What we've also seen, which is a challenge, is the fact that there's already been a pronouncement to the fact that no one can travel to various countries unless they are already vaccinated. Now, at that point, you will note as well that the hoarding of the vaccine is a huge issue in America. Moderna, that is got manufacturing capacity there, can't export to any other country until the American needs have been sorted. Then in the European Union, they also ordered about probably 2-3 times more than what their population requirements are. Even there, they've now started making a call that there should not be any export of the vaccines whilst they have not fulfilled all the orders and the requirements in the European Union. So this basically means that once again, Africa has got a risk of remaining behind and being the one that's got least vaccinated, but carrying the highest burden of the infection. So from that point of view, the African Union, under the chairperson of President Ramaphosa, created an entity which is called the African Vaccine Access Initiative, a task team. Now, this task team has actually focused on filling the gap, and this gap is between the 20% to the 67% of the population that we need to be vaccinated in the continent. And out of that, we've actually participated here with a number of players, minister from Nigeria and a few others who are the envoys who have been asked to negotiate the easing of the debt burden for most of our countries. And out of this process came this initiative that we need to find additional resources to finance the remainder, the gap between the 27% of the COVAX and the number that is needed for population immunity. Out of that process, then the approach was then made to the Africa Exim Bank, and as part of this team sits the president of the Africa Exim Bank, President Benedict Orama, and the arrangement here is that there will have to be a credit facility created for the states, in the member states, to be able to approach those manufacturing companies to procure the vaccines for purposes of vaccinating all our people, and then use that as a buffer, a kind of financing mechanism. But it's all linked to the initiative from the World Bank, where the World Bank has set aside over $12 billion, which must be used for various countries for COVAX-related activities. So because of that, then the Africa Exim Bank has set aside probably something close to about $2 billion or so dollars, and then in total, it estimated that we could be needing close to $6 billion for the whole of the continent, which means that for each country has to go into the Africa Exim Bank and make their own arrangements to have an advance that will be used to procure the vaccines. What is most interesting is the fact that we're having a difficulty having access to vaccines, but we're not asking for them as donations. We are also buying and paying like any other country. And because of that, then it becomes important for us to find a mechanism where the AU must then use its muscle for economies of scale to be able to procure huge amounts. So out of that process, the Africa Vaccine Access Task Team has actually negotiated almost all the vaccine manufacturers, and at this point has secured about $270 million worth of vaccines, which all the countries, member states, need to now access the Africa Exim Bank or the World Bank to be able to go and place an order and claim their share out of what has been allowed. Obviously, 270 million vaccines is not enough, but there are also some options that are available. We have actually looked at the issue of the AstraZeneca as being the one that seems to be probably easiest available. Then there's a Johnson & Johnson, which whilst at that point we didn't have the results, it seems to be very promising with good efficacies. And then, of course, there's Pfizer, which has got very difficult conditions for cold chain maintenance at -70 degrees. Then we've got Moderna, which is for all practical purposes very difficult to access because of both the cold chain conditions and the cost and the conditions from America. And then Sinovac or Sinopharm from China. This one is also quite effective, but we still have outstanding results that we need. And then the Sputnik V from Gamaleya Institute in Russia, and this one was released yesterday to show that it's got very, very high efficacy rates. So all of these together are now the menu that we're actually going around. It is clear that we have to actually go for multiple supplier approaches wherein we grab whatever is available on the market. But there's quite a lot of challenges across the different countries, everyone vying for the same companies, and the supply is not going to be adequate to give us all what we need now. However, I think the real pressure is that all of us, all the countries throughout the whole world, are trying to get as much of vaccine as possible between now and June. After June, I think there'll be a lot more, capacity to manufacture more of these vaccines. I think we need to then come back to a few principles, which I think for me has been very, very important as a learning curve. Firstly, in the response to the COVID-19, the issue of unity of all the people in the country led by the government becomes very, very important, that the government must spearhead the way and mobilize everyone, all the sectors, multi-sectoral response from all the various players in society, so that there's one message, one direction, one response. And that, of course, it's important to keep the principle of social solidarity, that whatever gets done is done for everyone on the basis of equity and on the basis that it has to be done for those who are in greatest need, not on the basis of those who have got the greatest means. And that for us has been a very, very important. So a very bold leadership with a clear, communication strategy and accountability, answering questions, dealing with all the issues so as to take people along, because in between there's some of the things that create distractions, such as corruption, mistrust, and all of those issues. We need to be able to neutralize them. So we have learned from our experience that there's also going to be a need to be more creative beyond the COVAX facility. And of course, the AU is another very important platform, with the state making funding available through donations and through the loans. At the same time, we also have to consider some of the bilateral arrangements. We have found the private sector very, very helpful, both medical scheme and private business. And I think part of what this discussion should be is to look at whether we can be in a position to mobilize the SADC business to actually work together to look at what can be financed to help us with the procurement of the vaccines. We've already seen one company that's operating throughout the continent. MTN has put up some contribution which has helped to access some of the vaccines which should be available for all the countries, particularly for the health workers. We're looking at the health workers as to be the first ones to be protected, and then of course all of those who are in frontline workers as well as comorbidities. All of that becomes some of the approaches that we've all kind of agreed. All the ministers at SADC General tend to be in good communication as well as through the whole issues to deal with of getting the community to accept the vaccines, the myths, the disbelief, the fake news, the mistrust on government and so on, all of these that have to be dealt with. All of that together means to us that we need to keep a continuous communication, make sure that between government and civil society, NGOs, business, labor. There's a free flow of information that allows us to be able to combine our efforts as we move forward. So all in all, I would say that, yes, as SADC members, we need to actually continue to work together. We must understand that there is no boundary when it comes to COVID-19. People are going to move. So therefore, vaccination on the one side of the border means there must be vaccination right across. No one needs to be left behind. And that should be the purpose of our approach as we deal with this. With that, moderator, let me just say from our point of view, we want to just encourage that the dialogue needs to continue, but we need to pull in those with resources to get them to work with us and contribute beyond what governments can themselves do. And there might be a stronger word and a voice coming from non-governmental sectors. And therefore, let's take this initiative as one of those that can help to support the government initiative and limited resources from our governments as we're trying to procure vaccines. We will have to procure vaccines. We need to do it quickly, but at the same time, we need to make sure that we collaborate, share information, and see what else we can get as we share resources to make this response effective. At the end of it, the SADC, together with the rest of the continent, should not be left behind as being the one part of the world where we can't travel anywhere because there are so much of restrictions because we are left behind. With that, let me say thank you very much. Sorry to take so much of your time, but we'll be ready to be part of the conversation. Thank you very much.